Hi, I am Dr. Poonam Malik. I am a prosthodontist and implantologist practicing from last 16 years. Over a while, the journey of implant, I just crossed placing my last 2000 implants with the starting of this year, making it as more of a happy new year 2006. And I have been probably would like to add to this line that I have been seeing more of an alveolar bone right now compared to my own reflection. I have been using 3D imaging over a decade now. I started my implant practice with 2D imaging, which now I find to be more a blindfolded technique. So shifting to a 3D imaging was a good decision of my life. Again, I should say that where I was looking at, this was the machine I was looking at. So I started using ostium a year ago, and once I introduced this in my practice, I find it to be more reliable, as like a spouse, which is more comfortable in the morning, which does not give you any headache. The ostium CBCT is just like the gold standard what we look at a CBCT machine, which is not exactly a machine but a system which has been provided as a multiple FOBs are been present when we talk from our practice, from a general dentistry to an endodontist to an orthodontist to a surgical oral maxillofacial surgeon who is looking at the FOBs, or to the one who are placing implants. So all the FOBs are being included into it in the same machine. Secondly, it's give more clarity. It's more a clear image is been provided only in the ostium, which I find. Third is the learning of the software. We don't require to become a software engineer for that. The moment it is introduced in your practice, the ostium people make it so easy to learn that within the next day you start integrating it into your practice. I have been using T2 Plus in my clinic, and that too it's been upgraded to a warranty period of 10 years, which I find that to be an added advantage for a clinician, which has been provided for such a long warranty period to that instrument. The first impression was, where was it? What I was finding out from the so many years from the 3D imaging, or what I was missing, it has completed my practice in that way. In the way of clarity, in the ways of FOVs, in the ways of journeying the ROI, everything has been covered by this machine. I cannot even think about it now, being a married lady, like I cannot think about my husband or my child. Similarly, I cannot think about it in my practice. I am not having that T2 in my day-to-day life. So my practice starts with the plan, any case, whether it is an orthodontic case, whether it is a surgical case, or if an implantologist practicing. So my case starts, the planning starts itself with the imaging, the first scan. After the scan, we are easily able to judge where is the implant size, what is the size we are looking at, what is the bone quality we are looking at, and it has made me, patient, understand the difference between a 2D and 3D. Patient says, wow, what I was being told about that implant cannot be placed in that region. When I see that the patient sees their 3D imaging, they feel it to be more confident, and they say, yes doc, please go about it. So it has made my practice more easier to explain in the patient point of view. It had made my practice more in an accurate point of view, and I can sleep well without thinking, oops, the oops figure have been out of my practice. I can say that I have been placed my implant in the right correct curvature, right 3D positioning, with the bone have been integrated into it, and the results will be the best. And definitely if you integrate the T2 with an ostium implant, it is like gold standards. So I would in this I would like to tell you about two of my cases. Recently, patient got an RCT done, and it was a microscopic RCT, I should say. And the patient still had a pain for around 6 months or one. She came back to me saying, "Doc, the pain is not going. The teeth is already dead. Why is the pain not going?" There I decided to go for the endo FOB of my using my FOB in the endo version, and then we evaluated, and we were able to see the third canal that was vacant and that was not being diagnosed even looking at the microscopic level of doing an RCT. So in this way I would say that I was blessed that I was able to diagnose that and given the patient a painless dentistry, that what we dream in these days. And another case, I would also, I'm not a more of a surgical person, but a case came to me that was of a dentigerous cyst. And when we look at the 2D image, we are not able to judge that how much is the buccal bone involved or how much is the lingual bone involved. And same kind of case came to me 10 years back. Same kind of case, and we operated that, and there the patient had a issue of having a numbness for around 6 months. So in this case I was also skeptical that whether I should go for the surgical part or not, but I had an added advantage this year that I had a T2 software. So I just got that CBCT done at my clinic, and I was able to see where I should be landing, where should be the incision land, and how will I am going to do it inside my clinic under an LA, not under even GA, reducing the amount for the patient. Was happy that hospitalization is decreased and the patient will able to get good recovery, and I was more able to explain the whole of the procedure to the patient at an ACE. So in that way I would find in those kind of cases it is very easy. Third, since I am talking about being an implantologist, so whenever you are doing an immediate extraction case, so when we try to even save the buccal bone, we land up ending sometimes that the buccal bone comes out or being lost during the extraction period. So in those cases, when we plan it with the help of the CBCT after extraction also, we are able to see that how the placement can be done in a 3D positional manner. So all the 3 phases of my general dentistry, of my surgical part and day-to-day routine, I was blessed with all the 3 ways, and my practice can move ahead and in an easier way. So I was very happy when it was introduced, and these cases when evaluated I was like, oh wow. So the smile on my face will give an answer for that. So Ostium support system is great. Always I felt like a family being a part of an Ostium. It's not just about using Ostium product, of using Ostium implants that I've been using from the last 16 years. But if you talk about the T2 which have been recently taken over by the Ostium team, the more efficient they have been giving me the feedbacks I have not received from any of the 3D imaging center. Even when I was having a 2D imaging VATEC, that also had a lot of loopholes that the person used to come within a day or two, and it was harming my professional life, as well as that I was personally not able to take that time period when 2D was not working. But if I come to the efficiency of the Ostium person or an Ostium team, they are just awesome. So I've never lied in my profession till date over this 200 successes that what I have, and Ostium CBCT make sure that if a single one bad day I should not come across. That is the best part of my team. I would say that stop being a hero in your practice. Just see the reality. What you see is what you do. It is the diagnostic clarity which you should look at while you're doing your cases. Ostium is the best, I would say, and the system is the best machine. It's not just a machine which requires a maintenance like a supermodel or like a supercar. It's just a Ferrari of clarity. Where were you? I was missing you from the last 16 years. I should say that when I placed that 1900 implants, where were you? I would have placed it more better position. So give me that diagnostic clarity, and Austin people, just make me look more younger with your diagnostic tools in the years to come. So stop overthinking and stop looking at the bone. The overlooking won't make that bone look thicker. But yes, using that one diagnostic tool make your life more clarity and more easier. You'll have a better sleep. I would say that thank you so much. I am blessed to have all the awesome tools at my clinic, including the T2 software. I am able to generate that ROI within a span of, I would say 6 months, and I will be generating more ROIs and buying your more implants. Believe me, I'll be getting more better to you this time. Thank you so much for your time and patience, and I wish Austin team all the best this year, and look forward to be meeting you all in each and every aspect of my dentistry and making ahead my dentistry life more easier and more comfortable, better, more reliable.